All right, Scott, you should be all set and the meeting's recording.
Great. Well, welcome everybody. We're going to give everybody, I guess, the rest of this minute. The PowerPoint deck's a little longer today, so I want to make sure we try to get through all of it and leave enough time for questions. So I'm going to start fairly promptly at 1 o'clock, okay? As we are going, just some house cleaning. If everyone put themselves on mute, but feel free to put any questions you might have about any of the topics or slides in the chat, and we'll try to leave some time at the end to address all those. All right, so for those of you who this is maybe your first IMC webinar, welcome. IMC stands for Integrated Musculoskeletal Care. And my name is Scott Eiselt. I serve as one of the clinicians with IMC. I'm a physical therapist by background, and then also function as the VP of IMC's clinical operations. So, we often do a clinical conversation every other month. It can, in the past, it's focused around preventative topics. Today, we're going to touch on some common injuries that people may experience. It may or may not include an injury you're dealing with, but some of the concepts are generalizable, or you can transfer them to another part of the body. So we're going to touch on some things that people will likely have experienced or maybe are currently experiencing. All right, so we'll kind of dive right in here. Just a few kind of facts about joint pain, that are going to be relevant to the conversation as we get into it. That many of the, let's say, common injuries are often what we'd call like soft tissue based. So some things we'll talk about today are like rotator cuff tendonitis or impingement syndrome or tennis elbow or plantar fasciitis. And these are kind of syndromes or diagnoses that people get where they have soft tissues, which are muscles, tendons, or ligaments that have been injured or being aggravated, in some fashion, causing pain. But having a label of such doesn't always tell us the root cause of that problem. All right. So some of the information we're going to go through today is considering other root causes that may be giving you the presentation of tennis elbow or plantar fasciitis or rotator cuff pathology. All right. And so we're going to go through some exercises at some point that shows you how you can kind of troubleshoot that as well. And so one of the things that's important to recognize from a root cause perspective is that local joint pain, so that's pain that's just like in your elbow or in your shoulder only, is commonly referred pain from the spine. Okay, so a study was done where they looked at all the different joints. You can see that on the right there. Those numbers are the percentage of problems that study found originated in the spine that they were able to resolve. So 26% of knee pain and 48% of shoulder pain, 44% of elbow pain, et cetera. All right. So it's common enough that it's important to look at it and screen for it if you are currently struggling with a given injury of some type. Okay. And so IMC's clinicians do this as a standard part of our care process, is to make sure we understand root cause before we apply treatment to something. The next thing that's important to note is that more than 90% of musculoskeletal problems are often mechanical in nature. This means they can change with movement, exercise, stretching, strengthening, repeated movements. And so a movement-based approach is important. And approaches like taking medicine, injections, bracing, things like that, although they have their place, they are not often going to lead to resolution ultimately of the problem. All right. And then lastly, the vast majority of problems can actually change quite rapidly. So depending on the joint that you're talking about, or that you have an issue in, you can have kind of what we call mechanical problems within the joint. So the joint's not functioning the way it should. And if you can drive the right movement through that joint, then the joint starts to function more normally. I think of this like a screen door off its track, okay? So the screen door is still working, but it's a lot harder to kind of walk it down the track or pull it down the track. And if you can pop things on track properly, then now it's a lot easier and things function the way they're supposed to, all right? So that can occur in our joints. And when that's happening, other things can start to hurt. It puts excessive stress and strain on muscles, tendons, ligaments, things of that nature. And so we're going to, with the joints that we discuss, I'm going to show you an important movement that you can try if you're having a problem that will often tease out whether you're one of those rapidly changeable joint problems. Some of the kind of common injuries we're going to discuss today. Again, there's a lot of them, so this might be kind of a more of a overview versus a deep dive. If there's a interest in a deep dive at the end of one particular body area, then maybe we'll do another one of these and focus on a given joint instead of all of these. All right. So in the shoulder, you hear impingement syndrome commonly, rotator cuff tendinopathy, which is another tendonitis is technically an inflamed tendon. Tendinopathy is an injured but healed and weakened tendon. Tennis elbow, I think I should probably rename this to like pickleball elbow, because you're seeing a lot more of that sport these days. And so that gives you this kind of pain at the outside of your elbow when you grip and lift. Within the knee, you have runners or active individuals get IT band syndrome, which is a kind of outside of the knee pain. That's a common thing. And then patellofemoral syndrome or patellofemoral pain, which is kneecap pain in the kneecap or just below it. All right, so we're going to touch on a few of those. And then the ankle, we're not going to spend a lot of time on sprained ankle, but just might talk about it when it comes to like healing and phases of healing and what to expect. But plantar fasciitis is a common injury. People get heel pain or arch pain, and it can be a chronic issue and really limit your ability to be active and functional. All right. So I touched on this beginning. It's important we subgroup by root cause. Okay, so we talked briefly that there's some that are coming from the spine, some that come from the joint that can rapidly change. We're going to talk about that. Others that come from muscles, tendon, ligament injuries that need healing, and then proper therapeutic or rehab approach. All right, we're going to spend a little time on what that means. And then lastly, there are some that are what we call like structural. So maybe somebody has an injury that needs a surgical approach, or maybe someone's grown a bone spur or something like that they can't change. That's just how their structure is. And then others that might be like inflammatory dominant, so they need medicine or an injection. All right, that entire other group makes up less than 10% of all the problems. So we're not going to spend a lot of time on it, but know that if you don't respond to movement-based care, that might be one of the reasons why, is you have some other root cause. Okay. When it comes, if you look at the foot anatomy, I put that in here. If you look at all the layers of tissue, so if you have foot pain or shoulder pain, doesn't matter which part of the body we dissect, there are layers upon layers, whether it be nerves innervating soft tissues and ligaments, which you see are like the white parts, muscles and tendons, which are the red parts turning to white. Okay, all those can be, they're innervated with nerves and blood flow, and they can be injured and cause issues. Finding out which one is the actual root cause and pain provoker is important when you're going to address it, though, with movement or treatment of some kind. Just kind of touched on this, don't want to spend a lot of time here, but the strategies that we would use given the origin are different. Okay, so this is why you can't paint a broad brush. You sometimes hear people say, well, I'm going to therapy for that. And something I read recently is that physical therapy is a profession. It is not a treatment. Okay, and you will get different treatments or interventions if you go to therapy. All right, but we can't generalize that all physical therapies can be the same. All right, so different causes require different treatments. So if it's from a spinal origin, you need to move the spine in a given direction to its very limit. If it's a joint origin, similarly, but you got to move the right joint. Okay, and you got to move it in the right direction. And then lastly, if it's one of those soft tissues, you got to determine which one. So you can be strengthening and conditioning it, because that's important. If it's a muscle or tendon, they don't like to be stretched. Versus the other way around, if it's a ligament that was injured and then heals in a shortened or tight state, it needs to be stretched. And strengthening isn't going to help that ligament, all right, because that's not its function. All right, so diving in. Lastly, when we're considering injury, it depends on what time frame it's been if we're injured. So if we have a mechanism of injury or a moment that something occurs, we sprain our ankle, let's say, we roll our ankle out to the outside, as some have probably done. Typically, the first phase is the inflammatory phase. You're talking a couple of days, and most of the time. It can last up to 2 weeks, but it's usually a matter of like 3 to 5 days. You got to be protective during this phase. All right, where you try to just let the body start to work. Inflammation is good. in this phase. That's how our body starts to set the stage for healing. It's not a bad thing, okay? And then you go through about 6 weeks, sometimes a little more, of a repair phase. That's when the body starts to fix whatever was injured, all right, with different types of cells. When it fixes itself tighter and weaker than it was in its original state. So then you have to go through the third phase, which is the remodeling phase. And this is when we get stronger and more flexible, and we have to then use therapeutic efforts to restore whatever function or abilities we had before the injury. Okay. This is being a soft tissue injury. We're going to get into more phase 3 today, kind of phase 2, phase 3, because if you're in the first phase after an acute injury, you should be protecting it, resting it. So just touched on this briefly a minute ago, but muscles and tendons and ligaments are different types of tissues, but they require different therapeutic approaches. So they require remodeling, strengthening, or stretching, depending on what the tissue type is. All right. And often we're going to get into some rules here in a second, but often that requires us to make the structure uncomfortable. We have to reproduce the painful movement or activity in a therapeutic manner in order to stimulate the body to change. Okay, so this complex fiber network you see in the picture here is showing if someone had an Achilles tendinopathy, so that someone's had an Achilles injury, the body then has healed it, but it's healed it with a weakened tissue, which is let's see if my pointer can work here, this like grayish, brownish, abnormal collagen it's called. And when we do a heel raise, all right, and use that, it might be painful, but you're pulling on these abnormal structures. And what that does is it stimulates this little cell in here to tell the body it needs new tissue. So then the body then sends in this yellow, which is the corrected tissue that's more functional. It's healthier, it's longer, and it's stronger. All right, so that's an example of how sometimes you have to do the painful activity to make the tendon return to its normal state. Often what will happen is sometimes we get given exercise, we get told like avoid the pain, all right? And we do all this strengthening and people get frustrated because they're not getting better. And there's a time for that. As you saw, if you've been acutely injured, we should avoid the pain. We should let our body repair and heal itself. But once it's done that, it's important we load our structures properly to return them to the health they were once at. But as we do that, we have to do that in a responsible manner, okay? And so I'm going to give you kind of a rule that we follow therapeutically to make sure you protect yourself against re-injury and aggravation, but that we stimulate a structure enough that it tells the body that it needs to change and go through that process that I was showing you here a moment ago, okay? So one of the ways we do that, see its graph on the right, is that if you had, and I'll show you some exercises in a minute, but let's just say you had like shoulder pain with lifting, and we had determined it wasn't a spine problem and it wasn't a local joint problem like we were talking about, and we think it's the tendon. Well, we would have to find a strengthening activity that reproduces your tendon pain to upwards to between a 4 and 6 out of 10. All right. If you're producing pain in an area that's a 7 or above, you're more likely to aggravate it or injure it more. So you got to protect that area by only going to that 6 out of 10 is the peak that I would tell somebody. All right. But that's also a right amount to stimulate it. When you're done with that activity, then it should last more than 5 minutes, but less than 20 minutes for it to return back to baseline. Okay. That would be an adequate and safe stressor that you're putting yourself through. Pretty uncomfortable, 6 out of 10, but it readily settles down when you're done. Okay. If you have constant pain, this means you have pain at rest. That typically would not come from a muscle, tendon, or ligament that is healed properly. Those only hurt when they're used or stretched and they've gone through the healing process. They wouldn't hurt all the time. So if you have constant pain, that's more likely a spinal problem, maybe bothering a nerve all the time, or a joint that's not working right. They can ache, or some other source in that other group, but it would not be this group. Okay, so you should start with no pain if you have this type of issue. And like I said, you do an activity that would cause it to be uncomfortable to a 6, and then it would settle itself back down. And I'll show you some examples of this here in a minute. All right. So we call that the 20-minute rule. All right. To properly remodel a structure, you often then have to recreate this graph, so to speak, with activity. You do that activity usually around 10 to 12 repetitions, and you should do that about 4 times a day. All right. If you're dealing with something like this and you want to try to self-care, that would be my advice. However, it's also better to probably, get with a clinician who's trained to be able to kind of give you guidance and progress you properly. But that is, I'm just going to give you the information as to how we approach these problems. All right, so we're going to go through, so with those kind of concepts in mind, all right, we're going to go through a couple things. So we're going to talk shoulder and elbow first. So if you have a shoulder problem, what do rotator cuff pathologies sometimes come from if they're aggravated or impingement? Would be like overhead activities, maybe tennis, throwing, maybe you've started weightlifting, maybe it's sort of some new push-up routine, those types of things, okay? Pickleball. But one of the things we got to do is we got to make sure, as we mentioned earlier, that you are not a spinal origin problem first. So this is kind of, for those who've been on these before, this is an example of a spinal screen. If you have elbow pain or shoulder pain, I recommend you perform this movement 10, 12 repetitions and see if it changes whatever it is that's painful for you, okay? So you draw your head in and then you pull it back over and look up and backwards as far as you can go. You would repeat this in a cycle 8 to 10 times and then recheck whatever was painful, okay? Today we're going to assume, because that would be a different webinar, that doesn't address it. If it does make it better, then that's the kind of thing you would do often 5 to 6 times a day. And within a matter of 2 weeks, you should be significantly better, like 80+% better. All right. If you do affect your problem with this movement, sometimes it requires some other movements other than this to resolve. And so I would recommend contacting somebody on that front. Unless it fully feels normal after you do it, then you probably can take care of it on your own. If we're talking shoulder first, all right, often if it's a rapidly changeable shoulder problem, pulling your arm up behind your back, we rarely go there, is going to be painful and tight and limited. But restoring that ability will restore the function of the shoulder, okay? So in this circumstance, you can use a towel, or if you don't have the flexibility to do that, you can just use your other hand and grab your wrist and pull it up your back, okay? Same as the neck one. You would do 8 to 10 repetitions and then recheck whatever it is your shoulder isn't doing well. If that's lifting out to the side or putting a coat on or something like that, or doing a push-up, okay? Those types of things if they're painful. All right, it's a great stretch, puts a lot of stretch on the rotator cuff. The area that gets impinged in our shoulder, and will often pinch one of the rotator cuff tendons, gets spread out or gapped, so it doesn't pinch as much when you do this exercise. So often limited in those two conditions, and if you can restore that movement, it'll often then greatly impact that problem for the better. All right, so now let's say neither one of those things help, okay? And you're left with this painful activity. I picked one activity, but this, as far as like a resisted arm raise out to the side for this. And we're gonna remember that 20-minute rule, okay? But you could do this with any activity. If your shoulder hurt with push-ups, then you can make the push-up the reason. So our body is very specific. So whatever it is that it's not doing well, if we've determined that it's not the spine and it's not the local joint, and we need to then remodel or recondition it, you have to do the activity that it doesn't do well. Doing other things that are good for strengthening will help the area, but they may not be targeted enough, okay? So for this, like a rotator cuff issue often involves lifting a weight out to the side. All right, so you'll see this person uses a resistance band, they step on it, and then the arm in question is you then raise it up out to the side, okay? And you perform that 10 repetitions or so, or enough to bother it to that 6 out of 10 like we talked earlier, all right? Now, one thing to note in this image is there's something called target zone loading. So if you watch her, she doesn't go all the way through the range. And the reason for that is she's only moving the shoulder in the amount of range that's painful. So she's keeping it where it hurts. Often with a rotator cuff tendon issue, the bottom of the movement and top of the movement won't hurt, but right around above and below 90 degrees, it'll be very painful. Some programs advocate for strengthening in the pain-free range, but then that range will stay pain-free and strong. But it's important that we actually strengthen and condition in the painful range, where the pain is, so that the body starts to change, okay? Often recovery from a tendon issue will take 2 to 3 months in total, all right? But every 2 weeks, you should notice an obvious improvement if you have the root cause correct, okay? So that's the shoulder. We're going to move on to some other joints, very similar format. I'll show you those and then we'll have time for some questions. All right. For the elbow, remember, we assumed it's not the neck. We ruled that out. Okay. The elbow movement, to make sure it's not the elbow joint, is forcing the elbow to straighten as far as possible, often using a table or a base of a chair to kind of stabilize the bottom of the arm. Okay. And by forcing that joint fully straight, let's say you couldn't lift a cup well and it hurt to grip and lift like a Yeti cup or to grip your pickleball racket, okay? You could grip it, test it, do this stretch 10 times, and then re-grip it. If it's the joint and it needs a targeted stretch like this, you would be noticeably better afterward, okay? If it's not, then we need to move on to some target conditioning and target strengthening, all right? And for tennis elbow or pickleball elbow, I'm going to call it now. That's actually called lateral epicondylitis. All right. And the way you stress that would be gripping and then pulling a band or a light weight or a can of soup, something that was of decent weight, upward. All right. And this would then stress the muscles and tendons that attach right on the outside of the elbow there. Okay. Again, performing 8 to 10 repetitions in that painful area, 5, 6 out of 10 at the max, okay? And making sure that it goes through that pain curve we talked about. Again, it's going to be painful every time. It's going to be Groundhog Day, all right? But then in a matter of 10 to 14 days, about 2 weeks, you should be like, I think I'm 15, 20% better. And as long as you keep making the activities harder and harder, then over the course of a couple months, it should fully resolve. There's the elbow one. Sometimes with this, the last thing I'll note on that is that you will have to change the grip width. I've had people who like kind of the width of a tennis racket or a handle, or sometimes you have to hold on to a wider container like a can that is more specific to your problem. So just be aware of that if you fall in this group. So we're going to move on to the knee and ankle, okay, or the knee, foot, ankle. I'm going to show you one quick of these. This is the screen for the spine. If you have issues in your knee, 1 out of 4 are going to have actually a low back problem, not a knee problem. Okay. And so same goes if you have foot pain. I would try this 10 reps before you try anything at the joint level. Okay. For the knee, kind of like the elbow. Okay. It needs to be straightened as far as possible. All right. To determine whether or not it's actually a local joint problem. So this is a great stretch for that, where you can lean against the wall, use your hands above the knee and force the knee backwards as far as possible. So if you're dealing with like IT band syndrome, which is like that lateral knee pain, often runners will get this, all right? Or anterior, like kind of kneecap pain, all right? So this can help address some of those issues or tell you if you actually have a more of a tendon problem like we're talking about with the elbow and the shoulder. All right, so that's how you perform that one. So assuming that didn't do anything, then we would move on to some type of loading program. So in this circumstance, the first person had knee pain, you would do kind of a step down and repeat that kind of painful arc. All right, and by doing that, it's going to stress the tendon that's on the front of the knee, okay? And same goes, as long as you follow those pain rules, that's a safe thing for you to do. Maybe you can't do that, and maybe you need to start with like a squat or a sit to stand from a chair, all right? Because you need the help of the other leg to start. That's enough. You can do this as long as you're following the same rules. That's just fine, okay? Sometimes runners, if you have outside of the knee pain, it's more of a fatigue-based issue. So maybe it only shows up after like 2 miles and you want to be able to run 5 miles. Well, actually, then you're going to have to run to the point, maybe even run, walk to where you bother it and slow. And then that's all you bother it a little bit and let it settle down like on the right. And then slowly over time, you try to crank that mileage up. All right. So sometimes it takes a fatigue. Okay. Lastly is the dreaded heel pain or plantar fasciitis. Okay. Um, so this is a great stretch for the arch and fascia of the foot. Okay. So you put the foot with the towel is the one with the problem, where you put the towel up underneath the ball of the foot. Okay. You put the healthy one or the good one forward, and then you kind of squat through it, keeping the heel on the ground. And this puts a ton of force on your calf, but also across the bottom of your foot and through the ankle. If you have a need, this can do two things in the foot ankle. If it's a rapidly changeable ankle problem, all right, you'll notice an immediate improvement in your ability to tolerate walking and that kind of thing. If it's a ligamentous issue in the arch, all right, this will stretch that ligament out. So if you have like tight ligaments in the arch of your foot due to injury or something of that nature, and they need to be remodeled, just like we were talking about with those other things, this can stretch them, but this will be uncomfortable then. But remember, it needs to be to stimulate the body to change. Okay. The other type of tissue in the bottom of the foot, though, is the muscles and tendons. And then you would need to use the muscles and actually target those by doing some type of strength activity. So a heel raise uses the muscles and tendons that connect from your toes to your heel. All right. So you would target that painful tissue in the same fashion that we targeted the other things, where you actually then stimulate a little pain, 4 or 5 times a day. All right. A lot of info in a short amount of time. Those of you who aren't aware, if you're listening to all this, you're like, that seems pretty complex to do on my own. We do have a web application that you can then take yourself through, like a self-testing, guide you through some of the things I just talked about. And we also have a clinical network that you can utilize too or tap into. Okay. And that would give you a self-care plan or route you to a clinician that could see you and walk you through it to help you out in those circumstances. Those of you interested in that, you can QR code that or app.jointstrong.com. That's a good place to start. All right. Okay. That's probably the most content we've gone through in 27 minutes. So Nick, any comments, any questions?
Doesn't look like we have any questions right now, but if anyone has any, feel free to put them in the chat.
Right. One note I'll say I didn't touch on the ankle sprain. I will quick. In those first few days, obviously protect, rest it, that sort of thing. In the repair phase, so that once you get past that first week, you start doing gentle range of motion in a pain-free zone. It's not ready to be pushed through pain. And then slowly you can start to work into like stretching it into that heel and ankle stretch that I showed you, or even starting to kind of purposely gently roll the ankle in and out to start to recreate some of the forces that the injury occurred in. But it starts to stress the scar that the body produces when it heals that ligament. So I know we didn't touch on that, but that in essence is how you would address something like that. But you'd have to wait until you provide the body enough time to heal itself.
Scott, it does look like we have a few questions now. So one of them was just if the exercises could be shared in a video format. And so I think I can help with that one. The app.jointstrong.com that you see on the screen here does have videos of most of these exercises as you go through the self-care pathway. And then also, if you ever are in clinical care with IMC, all of our clinicians share videos of the exercises as well. So for self-guided, the app that you see here would be great. And then we also do have videos of everything for anyone going through treatment with IMC too. And then next question was regarding anything on hip bursitis and that's aggravated by exercise.
Yeah, that's a great question. So first thing on the hip would be to test those low back movements. Okay, so back out for you. The back bend or the press up. Okay, often the hip was the highest joint that the spine influenced in that study I referenced. Okay, so doing, let's say, 10 press ups on the left or 10 back bends over a countertop or table before you exercise and seeing if you create some cause and effect with that. If you do, then watching things like sitting without support, they're going to be aggravating. Okay. If you can't affect it with that, then in the self-care app, there's almost, you basically would do like it's called hip extension, but it's like a hip flexor stretch. You kind of kneel and can stretch. That's in that self care app. Last but not least, often hip bursitis is on the outside of the hip. And often that can be weakness in what we call our hip abductors. So doing some either laying on your side and doing some leg raises into that, using those structures, kind of like the shoulder raise I showed you, or you would then do some maybe target zone of the outside of the hip. Those would be places I would start. And that's kind of generic without a clinical exam, but those are probably the places I would start with that.
Cool. And then there's a question about frozen shoulder and how any of these exercises might address that.
Yeah, Nick, you broke up. What did you say about frozen shoulder?
Oh, sorry. The question was, how does this address frozen shoulder?
Yeah.
And so any of these exercises that might be relevant for that diagnosis.
Yeah. So frozen shoulder, I would go back to kind of root cause conversation. Some of them, frozen shoulder, just happen for no reason, especially kind of in middle-aged women for some reason. It's the most common age group and gender. Other times it happens after a trauma. So we fall on it and the body scars the shoulder down. And lastly, I've seen it happen where you have like a pinched nerve, so you can't use your arm properly, and the neck can influence it. So I'd still go through the neck screen, okay? And then often a frozen shoulder will limit motion in all directions, okay? So you'd use that 20-minute rule, but then you would start to stretch in one direction first. Yet you're going to eventually have to stretch in almost all of them. So the hand behind the back is the most painful, but it also stretches the shoulder the most. So if you can start to improve that one, you'll often see some carryover into others. But you would then I often have patients pick one direction with me, and we start to try to improve one before doing too many. Okay. So if it's a true frozen shoulder, though, it is going to be very slow to change. And you're going to need to stick to one exercise 4 to 6 times a day, and really that pain curve I showed you. So that would be my initial advice. If you feel like it's just too much to try to address with self-care, then it's something that it'd be clinical assessment would help a lot to confirm the root cause. But then also you don't need to come a whole bunch. It's actually one of the conditions that if you know what to do, self-care actually works pretty well. But hand behind back is a big one for that.
Cool. And then the next question is about pain in the back of the knee and whether that might be from overuse or sort of indicative of a larger injury.
Yeah. If there was no mechanism of injury, so you didn't do anything that you remember, so you didn't try to sprint one day, or you didn't do a new like hamstring curl or something like that, just kind of started, I would go through the low back screening like we talked about. because the sciatic nerve actually goes right through the back of the knee down into the lower leg. And so sometimes people have a little pinch in their sciatic nerve and it can give them knee pain behind the knee. And then I would screen the joint like that straightening one to see whether or not that had an impact on it. Sometimes pain in the back of the knee, though, can limit like your ability to bend the knee. So I would just be mindful of that. It's not as common of a presentation as the sides of the knee or front of the knee is at first. So if you try that straightening exercise, which is the most common corrective one, just be mindful if it is aggravating anything or not correcting it, then you probably want to get it looked at. If it came on due to like running or like a hamstring, and it seemed like a hamstring injury behind the knee, then you could always try to recreate hamstring curl or some type of activity in that remodeling way that I was showing you with some of the other exercises where you use the pain rules.
And then it looks like we've got 2 or 3 more. So the next question is about if there's any more exercises that you could recommend for knee ligament issues.
Yeah, this is often where there isn't really a limit to the amount of exercises. So there's a lot of creativity that can be applied to any joint in the body in terms of what movements we would pick. And so often I was pretty careful today. I probably gave more than I often do. And then we have to be careful to kind of paint a broad brush with movement. And so I wouldn't necessarily add any exercises. It would be more, that should be a very personalized or specific thing. If you're having issues with ligaments, then I would make sure that you see somebody so you can get targeted. If you're talking preventative, joints love to move to their very limit in all directions they're supposed to move. So the knee is an easy one, and then it's a hinge. It's fully straight, it straightens and it bends. So if on a regular basis, you make sure you take your knee through its full range of motion, both straightening and bending, you're going to then maintain a healthy knee. All right. If one of those is limited for some reason, kind of troubleshooting through that is probably a good idea.
Cool. And then the next one is, are there any exercises for lateral metatarsal and cuboid pain that you could recommend?
If you have specific pain we could try the foot stuff we talked about. That's a place to start with that stretch that I was showing you on the towel. I would also try the low back screen just to be sure. But I would start here. But then if you need some other more specific movement, I probably would go back to being assessed by a clinician at that point versus trying to kind of go it alone if you're having very targeted pain like that.
And then the next one is person mentions lower back issues with pain in one leg. And then the question is specifically around sleeping and if there's any recommendations kind of around sleeping posture that can help to not aggregate something like that.
Yeah, often low back pain, especially if it's referring into a leg with pinched nerve, they'll have what we call a direction of preference. So if you would find what direction of movement is best, that can guide you into which positions you should avoid, because often the opposite are aggravating. So for instance, people who have back and leg pain, they're often worse with sitting and bending. So when you're laying in bed, you want to avoid like the fetal position or kind of curling up so that you're rounding your spine too much. You want your spine to remain more neutral or supported. All right. So, on your side, usually actually, on one side or the other, so you can try to keep your low back with a slight arch in it and not curled up is probably where the best. But I actually try to avoid messing with people's sleep unless that's the time they always wake up worse. Is that I try to therapeutically, I try to address the problem and resolve it so that you can address it during the day and hopefully get more restful sleep at night. But generally avoiding, flexed positions will help with people who are having sciatica or leg pain. Sleep on your stomach is fine, but in some cases, if you're not used to that, that could actually leave you quite sore depending on your condition. So I'd be careful to advise you without taking a look at it. But you might actually respond quite well. That's the self-care app. So I might give that a try too and see what information it gives you.
Cool. And that looks like it was the last question.
Right. Well, thanks everybody for attending. I know we went over a little bit. We're happy to do that and answer any questions you guys might have. So tune in again in, I guess, October it'll be for our next one. But until then, if you need something, feel free to go in the app. The app can also give you ways to connect to one of our clinic or somebody if you need to talk to a clinician, then connect that way as well. So take care. We'll see you again in October.